The opinions expressed are those of the show's host and not the staff or management of Port St. Lucie Broadcasters. Any reproduction without written consent of WSTU and WPSL is strictly prohibited. Now it's time for Quality of Life Radio, brought to you by WellMed. Here are your hosts, Gary Owen and Tom Bouvier.
Hello and good morning to all of our friends listening in on this fabulous Florida Tuesday morning. The sun is shining. We've got smiles that are abundant in the studio this morning, and it is already August 17th. I'm your special host, Gary Owen.
And I'm your co-host, Tom Bouvier.
Almost special.
Always special.
Half as special as the host, my co-host, but he's very handsome. And Tom, we are bringing them today live, the most fabulous, sought-after show in the world.
Absolutely. And we say if you don't like the Quality of Life radio show, you're either dead
or
asleep.
So hopefully you're not part of either one of those two categories that we just mentioned. And by the way, you can catch us live on WPSL 1590 and WSTU 1450 AM. Also, WSTUtv.com, live in the studio. You can catch our handsome mugs, and also on Facebook Live. If you've not connected with us yet on Facebook Live, why not? It's called the Quality of Life Radio Show.
Absolutely. And Gary, we come here every Tuesday morning to bring our listeners relevant content, information they can actually use. Secondly, we love to support and showcase local business owners, nonprofits, and individuals who will be introduced here in a moment. We're excited to have them.
What about doctors?
We love doctors.
Attorneys? Chefs?
I love chefs. But there's that lawyers, bankers, and something else Jimmy Buffett talked about.
Sharks?
Thieves. You remember?
Flip-flops. He was talking about flip-flops.
In that song, he blew out his flip-flop. But we also, as serious professionals, we love to bring education and information about insurance planning so people can improve their quality of life, and thus the name of the show.
Yeah, it's a great show, if I say so myself, and we get a lot of great content and a lot of great valuable information, special guest on our show. And speaking of special guests, before we get there, we've got about 60 seconds before we officially have to introduce our guests by 10:09 a.m. Insurance straight talk. Insurance is like the most boring topic. It's almost like watching grass grow, talking about insurance. But the Booth and I bring excitement, fun, laughter, education, information that will give you some great insight on what you might think about what you should do for your quality of life and health. And in all honesty, it's important that you talk to the experts. You know, if you get a boo-boo, you need to go, you go see the doctor, right?
Absolutely.
You have questions about insurance, you see the Medicare life and health professionals at O Insurance Group. And so we'll talk about that later on in the show. We're going to share some information with you about Medicare that it's very important that you need to know. So Tom, why don't you go ahead and do the honors of introducing our lovely special guest this morning?
All the way from Sebastian, Florida.
Where? Exactly.
Right. That's some northern city.
What bird? What's the bird? Pelican, right? The
white pelican.
The white
Yep.
pelican.
Mm-hmm.
The logo for Sebastian.
I have many pictures of the white pelican sitting on the dock.
Yes.
And so seems to be an annual tradition.
Oh, yeah.
I thought I was the only one
Yeah.
that knew about it.
No. Yeah.
I'm just kidding. Apparently everyone else does too. But all the way from Sebastian, Florida, we have Dr. Cheryl Winchell from WellMed, one of our sponsors of our show as well, but a phenomenal primary care doctor, has been practicing for 17 years, and I'm giving her information away. But anyway, welcome, Cheryl, and Tanner, who also works with WellMed to help market and promote their wonderful services at WellMed.
Before the doctor comes to the microphone, Tanner, get close to the microphone.
Okay.
I'm going to ask you a question.
Oh boy, I'm in trouble now, Dr. Winchell.
This is epic.
Okay.
So I follow you on Facebook every once in a while when I can
Oh,
take
no.
my
Oh, no.
mind and my eyes off the computer and my mind off business, and I'm following you, and you're like everywhere. You're from like Tupelo, Mississippi, down to Key West, Florida, and out to California. Do you have like a twin sister, or how do you do this? I mean, where do you get the energy to do what you do in the marketing for WellMed? It's an amazing thing that you do.
Oh, thank you, Gary. That's so sweet. Actually, what I do is I mimic her. If you look at her, you can see I think she moves more than I do. I just make sure and show my passion for life every day. And Dr. Winchell helps me to stay healthy so that I can do it. So
That's fantastic. I love it. Love your personality, love your smile, love your attitude. And Dr. Cheryl, this is the first time you and I have met.
Yes.
And I'm so excited to have you. So you said 17 years in Sebastian.
Correct.
Prior to Sebastian, because when you told me, I was shocked when you said 17 years alone in Sebastian. I thought you were only 21, but
Well,
fantastic
I
for
may
you.
still be.
I
Well,
love it.
29.
See that? How we
Oh, look
Google
how she's
her.
moving up now. All right, so where were you before that?
After residency, I was in North Miami Beach. And then after that, I was in Fort Lauderdale area, Tamarack, for a little while. And then headed on up this way.
So tell us a little bit about where you're from, the residency, and so forth.
So I was born in Michigan, and then we moved to Florida when I was a little kid with my parents, of course. And then I went back to Michigan State for college for undergrad, go Spartans. And then came back to Florida after my freshman year at Michigan State. We had a blizzard in October.
What?
Yes, and I was riding my neon green mountain bike. No, neon green beach cruiser bike. You guys all remember those?
Uh-huh.
To
Big tires.
oh yeah, to the miles and miles of campus that Michigan State has. And so I called my parents, and after I opened the blinds and saw the blizzard October, and I was like, I'm coming home, and they're like, no, you're not. Because that was when we still had phones on the wall with a long cord.
Yes,
If
I
you wanted
remember
to
that.
talk in private, you'd go out the door. So yeah, it was amazing experience being in Michigan State. Really was wonderful. I loved it so much. Then came back to school in Florida, Nova Southeastern, for my undergraduate, and did my residency mostly in Miami.
Fantastic.
Yep.
Where and when? Well, first of all, where were you when the idea came to you that you wanted to be a doctor and help thousands of people?
Well, there is a really weird personal story, and my best friend from
I
Michigan's
love
going to
weird.
crack up, right? So
Is she listening?
she probably is not, but I maybe could get her on there if we have a break, right? So after graduation, I didn't know exactly what I was going to do. I'd applied to a couple medical schools. I didn't really know. I mean, I thought about being a doctor, and I was a human physiology major at Michigan State. So I went to work with my best friend in Muskegon, Michigan, at a country club that her dad was the golf pro. So we were working in the pro shop and, doing the beer buggy and all. I mean, it was amazing. So we had such a good time.
I can see you as a
Yep.
nice blonde buggy girl.
Yep. Picking up the range balls, So once again, dating myself, we got mail at that point in time. So interestingly, my parents were getting all my mail in Florida, and they would send me manila envelopes up to Michigan. And I got a big manila envelope with all my mail in it, a bunch of it garbage maybe or whatever. And my acceptance letter to Nova Southeastern was in there, and my parents didn't open it. It was addressed to me. So I was in the pro shop. I think I brought the mail in. It was like probably 5:30, 6 o'clock in the morning. And I'm super close with my best friend's family. And her dad was there, and he walked in, and I had opened the letter, and I was reading it, and I was like, oh my gosh, like all of my ideas of going out to Colorado and being a ski bum and, traveling across Canada,
We're
all were like
dashed.
going into the mist. And so he said, what's going on? And I like sat down behind the desk there, and he's like, are you okay? This dad, are you okay? And I said, I just got into medical school. And he's like, that's good, right? And I'm like, well, I think so. I don't know. And so, yeah, the rest is history. So
That's fantastic.
got
story.
settled in and came back down and lived with my parents actually for 2 years. Drove, the commute was a little bit, but it was definitely worth it, with all
Sure.
the expenses that we have going to school. So, yep.
Your parents lived in
Fort Lauderdale.
Fort Lauderdale.
Plantation. Yep.
Yep,
At that time.
okay.
Uh-huh.
Fantastic. And what magnet attracted you to WellMed?
Well, so when I started practicing in well, it's really like a West Broward County Tamarack. I was there, and there was some kind of professional corporate situations that I was invited to, like meetings or whatever it was. And I met some people from WellMed at that time. They were not in Florida and only in Texas. And so during that time, we knew that we were buying property. We wanted to move. My husband's from upstate New York in the Adirondacks. So he, knows about 3 people. And when he moved to Florida, he was like, whoa, this is way too many people. So we talked about moving north from Broward County to, somewhere else, found property, and we're wanting to buy it. And then we had to build a road. There was no road, all this other stuff. So during all of those months, and then probably more than a year, I think, one of the people from WellMed would constantly call me. If he was in Florida, he would come and see me. And then I said, okay, we're moving to Indian River County. And he was like, well, that's even more perfect, because at that point, I think they already were planning like a footprint. And so it really just worked out. I came up here. I had a little bitty practice, very small building. That would WellMed took over after me being there, I think maybe 2 years. Just the copy machine that they brought in after they acquired me, because my copy machine was this big. I couldn't get patients into one of my exam rooms because they couldn't get past the copy machine without going sideways. So yeah, I mean, it was really an amazing, adventure, because we really had nothing. I was the north end of, this vast land of what became WellMed. We only had a few, 2, maybe 3, and then, grew from there. And now it's beyond even me telling you how many offices and so on are here in Florida. Tanner could give you a lot more information
Yes,
on
we
that.
can't wait to hear that from Tanner
Yeah,
later
for sure.
on.
Yeah, well, your agents are out there working it. So, yeah.
And I do feel really blessed to have been part of that whole experience. I mean, going from just WellMed proper and all the different things that we've been involved with, corporately, and through just having the ability to practice medicine in the way that we do, spending more time, having people that support us. I mean, it's just really, it's a different way, especially when I speak to my colleagues that are primary care. I actually am very blessed to be part of the new provider onboarding. And sometimes we'll have specialists that we bring into our corporation in Texas right now. Hopefully we'll get there in Florida eventually. And there was a cardiologist, and he was listening to all of our talk about, our processing, and, it's all primary care mostly. And he literally interrupted me during this WebEx with like 20 people and said, I am really glad that I am not a primary care physician. Whoa, you guys do a lot. So yeah, it's, it's an extraordinary day. I call it the Jack in the Box. You open the door. How are you today? And it could say rash, and you walk in and they're having marital troubles and chest pain. Oh, and a rash maybe, and so it's just a really awesome day. We love it. We have the time to spend. So
we have a minor in psychology as well.
I think now I'm a double major.
Just from on the job training.
Yeah.
I love it.
Psychiatrist and psychologist. Oh, and marital counseling as well.
I love it. So what is like the number one thing in your life that you're passionate about in your field?
For me, it's health and prevention, I guess, would be kind of the best bucket to think about it in. And I'm an osteopath, which I'm a very proud osteopath. I try as much as I possibly can to incorporate that into my day. It can be very difficult when you have a patient that's experiencing heart failure because they're not hearing you. Maybe they can't catch their breath and they're scared, and families wondering what's going on, and this weight gain, and, all of this. But there are so many things that you can incorporate into even that, right? So elevating your feet moves the fluid. I mean, that's a whole being of how do we manage our bodies, and to prevent that would be even better. So obviously nutrition, weight control, don't eat a lot of salt, and then exercise. I mean, it's key to life.
You better believe it. And I was going to ask you, I think we'll come back from break and I'll ask you the question, but I was going to ask you, you brought it up about being an osteopath. So what is a DO? We'll let our audience know when we come back from break.
Great.
What the difference is, DO versus MD. All right. You're listening to the Quality of Life radio show, the one and only world-renowned, exciting, fun, informative show right here in Stuart, Florida on WSTU 1450 AM and WPSL 1590 AM. and also on Facebook Live and WSTUTV.com. I know you may have to take a little tinkle, have a second cup of coffee. Be right back. All right. We'll see you soon. And welcome back from our short break. You're listening to the Quality of Life Radio Show. A big thank you to one of our sponsors of our show, Lot Insurance Services. You can trust them for all of your home, auto, boat, business insurance needs, or an airplane if you happen to have an airplane.
You've
Lucky
got two,
you.
right?
I have 3. I'm working on my number 4. And if you're
Awesome.
looking to save a lot, make sure you call Lot Brothers. They're located on US 1 just north of Midway Road in St. Lucie County. And also, want to give a big shout out to another wonderful sponsor that we have. Oh,
I wonder who that would be.
wonder, they may even be in the studio. WellMed Medical. And by the way, do you know that a good primary care physician is always in great demand?
You
Great.
know
And
one.
Great,
so
great.
many currently do not have a primary care physician or may not be happy with their primary care
A
physician.
lot of people.
So go check out WellMed Medical for all your primary care needs. And they have 4 convenient locations right here on the Treasure Coast. And Dr. Sherrill was with us at the WellMed Medical Facility in Sebastian. And good to have you with us on the show, Dr. Sherrill. So before we went on break, we were talking the difference between a DO and an MD.
So medical doctor, MD, medical school, have to have an undergraduate in something, and then science related classes to get into medical school, of course. And then the training is really for the both of us, medical doctor and osteopathic, the same in the first 2 years, other than as osteopath, we do a bit more learning about the musculoskeletal system, the lymphatic system, and kind of the description can be a holistic type of approach. Although I believe medical doctors were, of course, doing that before. I mean, you kind of had to back in the 1800s, I guess, right? But, perhaps got away from it or not. But they always do learn it, of course. We actually do, at the time I was doing it, was called OMT. It's osteopathic manipulation technique. We did that training within our first 2 years and then also within our 3rd and 4th years. 3rd and 4th year for standard medical school, both aspects are to go into externship where you're in clinics and hospitals, just depending upon your training path. And then beyond that is internship and residency. I was able to do a traditional internship, you call it, because I was kind of contemplating what did I want to do. And so within that first year out of medical school, I did kind of everything: surgery, plastic surgery, family medicine. We had a clinic that we went to once a week to manage our primary care patients. But really the basic difference is that we try to focus more on the osteo, right? The bone, the structure, and the flow, the blood, and health and prevention and nutrition and all those other things are very, very important to the osteopathic training.
So tell us, maybe Tanner may have to come in here in a minute, but I'd like to hear, I'm sure our audience who maybe don't have a primary care doctor, or maybe who's not happy with their primary care, and no matter where they are, in the country, because WellMed locations are throughout the state of Florida and the country and Optum. But what sets you apart?
The process that we have as far as our management and the way we perform our day-to-day duties with our patients is that we really spend a lot more time as physician providers. We do have mid-levels in our office, which are now APCs, right? Advanced practice clinicians, otherwise known as nurse practitioners and physician assistants. And so with practicing with our patients, we spend more time. A lot of our focus is really prevention, our new patient visits before they even see us. And if they need to see us that day or, as an acute visit prior to the standard process of coming into our office as a new patient, we do what's called a first touch. During that first touch, they're introduced with the staff, one of our medical assistants. And of course, they go through all their medications and get their chart all prepared and, put their name and address and everything else in there along with their insurance. They add in all their medications. And during that procedure, they do vascular screening, neuropathy screening, and then there's a lot of questionnaires that go along with the standard yearly visit, which hopefully everyone who's on Medicare is having these standard yearly questionnaires of, depression and bladder screening, urinary incontinence, fall risk, and all these things. And all those questionnaires are done during that time. Of course, anything abnormal is sent to us immediately, if things are normal or not. And then we have a patient visit shortly after that. Lab work is also done during that visit. If they're on certain medications, the staff will come to us, can I do these labs, Coumadin, PTINR, all these things. So that way we come into our first visit with our patients with a lot of information that we've been able to review in advance and kind of have some insight as to what their current experience is. It's difficult sometimes to see a patient who's on no medication because I'm sitting there saying, okay, well, what about your great great grandmother? So, in Scotland, do you have, back in the day? So it's really, we spend
She
that
was
time.
a drunk.
Yeah, genetically, how are you inclined? So we spend that time, before our patients even see us to get to know them, educate them. And, with that time spent, if it's a very healthy patient, we give them more information and education. If it's a patient that's not as healthy or needs a lot more work or, adjusting their medications, we really do have that time to spend outside of us as APCs and doctor seeing the patient. Our staff is our team. We work together doing the first touch, doing the lab. We have labs in our offices. Some of our office, Port St. Lucie West, has x-rays there in the building. We also coordinate really well with case management through the hospitals. If we have a patient that goes into the hospital, we generally are notified right away. Sebastian, compared to this metropolis, is quite small. So I have really great relationships with the two hospitals that are close to me. But even Advent, we use them a lot now for patients that are kind of tertiary care center. I've had a couple transplants over, actually, the past few years, I've had a few transplants. And even those hospitals know to communicate with us because our team corporately will get a hold of them and this is their information. And if you ever have a patient that comes through with the insurance that has Dr. Winchell listed as their primary care, they immediately let us know right away, either by sending a face sheet, the letter saying, or the form saying, the patient has been admitted. We also tell our patients, call us first, right? We have these little cards that we give everybody during their first touch or regular visits or hospital follow-ups that have a little key fob thing you put on your keychain or a card that you can put in your wallet that we want our patients to call us if they can before they go, right? If it's a weekend and they have a really bad, bite or cut or something, and they feel like they might have to go to an urgent care emergency room on the weekend, we want them to call us. Maybe we can help them over the phone. Or, there have been times when I've gone in on the weekend for whatever reason and seen the patients. So that has been an experience that we try to just go above and beyond and keep our patients healthy. Really, another big goal of it is as patients age on and, get into their late 80s and 90s. I don't have anyone over 100 right now. I think my oldest patient was 104.
Wow.
She passed a couple years ago and she made me the most beautiful doily. It was like one of those lace with the petals. at like 102. I mean, incredible. So we really do.
Was she Scottish?
She was, I think, maybe somewhere over there. Yeah, something like that.
Over the pond.
She was a vixen, maybe Irish. I don't know. I can't remember, but she was amazing. And so in those years, we try to really just make sure that we don't want them going to the hospital, not for many different reasons. And, people say, oh, well, it's cost and all these other things. Well, yeah, of course. I mean, who wants to pay copays? What insurance wants to pay for a patient to go to the hospital if they don't have to? So we try to keep them healthy, talk to their families. I've done video visits with their kids on the video. Whenever a patient comes in, if there's any question, they can get somebody on the phone and we just do it on speakerphone. I have this really amazing guy that had a trach he had some type of cancer and treatment. And now he has a voice box, right? And so I will call his case manager from the VA and have her on the phone because she has a way of communicating with him through their resources. And then we have the way that we communicate with him through our resources. I mean, that is important to me. This guy, has a lot more to deal with on a day-to-day basis than the majority of the population. So we try to just do everything we can, get them Meals on Wheels, get them transportation. We have video visits that we have our transportation services. We'll send an iPad to the house with the ability to take vital signs, a blood pressure cuff, and a scale. The patient can do their vital signs while they're on the video with us. All they have to do is the driver brings them the video and the equipment, and then they let us know they have it. And then we dial into that iPad and they hit the big giant, accept or whatever it is on the screen.
Very cool.
Yeah, it's really nice because we do normal video visits on the phone or computer,
Sure.
but that can be really overwhelming. And some people
Absolutely.
still have flip
Yeah.
phones. So
So, you're currently taking new patients.
yes.
Yeah.
Fantastic.
Well, I don't know. Am I? Oh yeah. Tanner says yes.
So your panel's not quite full yet.
Not quite.
it actually
It's full. Very
full.
But hey, bring it
I
on.
love it.
I'm a Spartan. I can take it.
So how
That's
many
right.
patients are you seeing a day on average, you think?
We actually try to max out more than 12, 14, 15. But beyond that, it's the phone calls and the process that we
Sure.
go through, individually as a provider. But I have an LPN in my office. I have an RN in my office. I have a really awesome team of medical assistants. Really, we try to make it at least 3, if not 4 as a team, seeing our patients with us. So, the vitals are done, all the questionnaires potentially or screening studies that we do, questions from the patient, updating their medication list with the staff. And then I'll go in and then that staff member, of course, is going to the next patient, right? So I'll have a staff person in the back that can help with the stat referral, can print up prescriptions if needed, maybe do a wound if we need to, EKG, things like that we try to just process all of that. So that team really is where the importance of the day, and really that's what the flow is, and that's how we manage our patients. But we do take a lot more time.
Absolutely. And that's important. This is what, Tom and I hear about this all the time from our Medicare patients is that, they maybe join a new Medicare plan, whatever, during a Medicare open enrollment period, which we'll talk a little bit about here in a little while. They get a new PCP because the one before is now not in their network, whatever. That's another issue that people deal with. And then we hear that, they don't like the doctor. No bedside manners, number one. And two, they just they're talking through them or at them and not with them, and really educating them. So we hear it all the time, and it's good to hear that WellMed is different. You guys actually listen to the patient. You take care of our clients and patients, and we applaud you for going above and beyond. And that's, I guess, WellMed could be called the Spartan Medical Group.
Hey, I would love
I see.
that.
Oh, yeah.
We'll paint everything green.
Oh yeah.
Whoa.
I want the helmet. Yeah, you can wear the
Yeah,
helmet.
for sure. You should see
They're
my
like,
son's tattoo.
Yeah. And the quantity of patients that a regular primary care doctor will see on a daily basis, maybe I've heard, and I've heard it from WellMed doctors at your academy that I went through, sometimes up to 40 to 60 patients a day a normal primary care doctor may see. Just if they have their own practice or with one other person, they're having to do that just to keep the lights on, whereas you guys 12 to 14, 15 a day, that speaks volumes because they're going to spend time with
Quality
you. They
of
know
care, yeah.
quality. and the quantity of time that they spend. So, and my wife's a patient as well of Dr. Mustafa up in Fort Pierce. So she's experienced it. She's never one thought of leaving or going somewhere else because of the great care. And she was in the hospital recently, and she had that liaison, that caseworker, connected with WellMed, letting every back and forth. It was a great experience. She was very happy with the time, despite.
And we're very proud to be partners
Yeah.
with you guys, with WellMed, and we are agents across the state. I mean, we have roughly 350 agents across the state of Florida, and it's great to be able to say, hey, we've got a collaborative effort here in an symbiotic relationship with WellMed, and we know the doctors, and so it's fun. I mean, you guys are great.
When's the next baseball game?
Yeah, right. Do you remember that time?
Wait a minute, I thought we were-
The next baseball game.
Oh, that's where we met you
Yeah.
first.
Yeah.
Right, Tanner, when's the next
Yeah,
baseball
Tanner.
game?
Well, wait a minute. What about deep sea
And this
fishing?
guy-
Hey.
And this guy is the announcer.
Oh, nice.
Yeah.
Awesome. I
For
didn't know
the,
that. Very cool.
He's multi-talented.
He is
But,
multi-talented.
Well, and I will
you
say,
should see him at night with his mask on.
outside of being a translator and a therapist and all that, when the patients come in, I will tell you, I mean, I love all our specialists. We try to work with certain number of specialists that we can communicate really well with, that we get records from, obviously insurance contracts, right? So patients will come in and I'll say, okay, what about, this medication or that medication? And they're like, well, why do I not know that? Why did they not tell me that? And they may have, specialists sometimes talk in different languages, I think, right? Or the expectation is that you'll understand when we have the ability to spend more time. And it's not just me. Once again, I mean, I can't talk about my team enough. My staff will then go in and I'll say to them, can you just review with them again? Make sure they get it. I can't tell. I mean, I have these notepads that I write, a little WellMed logo on the top. I must give 2 or 3, and I call them homework, and they put them. I have patients that put them on their refrigerator, put them in their bathroom. Some of them will write it on the little thing with my picture on it. So yeah, the job is to make sure they understand. And that is, some people will hear this and say, well, you're only seeing that many patients. That's why, why can't you see more? I need to be seen sooner. We try to keep you healthy so that you're not coming back
Absolutely.
as acutely, we're not having to do a visit with you in the office. Our nurse can have you come in and do diabetes review if your medication or your blood sugar is controlled. So we have a huge team of people that can help you in
And
that
who
way.
doesn't want to stay healthy and live longer? Come on.
Sometimes
Yeah, well,
nobody.
there may be one
Yeah.
person. Tanner, so I know that you give tours of facilities, and I know that, when we talk to our Medicare beneficiaries, our clients, and we say, listen, before you buy the cow, taste the milk first, right?
That's right.
And kind of like what you do. You give a little taste of what it's like in the facilities. You give them a tour and you meet the doctors and stuff. Walk us through that real quick before we got 2 minutes.
We got 2 minutes. Okay. Well, Tom and I know the process. Tom will have a prospect and is interested in maybe coming to WellMed, maybe coming to join Dr. Winchell, and he will let me know, and I will bring this prospect in, give him a tour, let them meet the staff, see the lobby, see the x-rays. We do the blood work right on site. And that's exciting because they get the feel of it. They get the feel of the office, the layout, and it gives them more incentive to come and join us, and they know that the WellMed is where they belong. So,
And every client that I've sent there and Tanner's done the tour with, they have called me or when I've communicated with them again, they said, I have never in all my years had a primary care group do this, make me feel so special before
Right.
I even went for my first appointment. So, for those looking for that primary care especially if you're on Medicare, give us a call during open enrollment between October 15th and December 7th. We can get you on a plan if it's right for you that one of the WellMed doctors could become your primary care doctor. And you can receive this type of care and preventative care especially.
And meet some really wonderful people. So-
Absolutely.
All right, so we're going on our second and last break of the show. You are listening to the world's finest radio show, and we call it the Quality of Life Radio Show because it's our duty, it's our mission to help you improve and enhance your quality of life. You're listening us to WSTU 1450 AM, America's Heritage Station, and WPSL 1590 AM. Stay tuned, and we will be right back.
Welcome back from our short break. You're listening to the Quality of Life radio show, and a big thank you to one of our sponsors of our show, United Healthcare. Did you know that you can enroll in a Medicare Advantage plan that includes access to their statewide provider network? And that's why now is the time to take advantage of a plan from United Healthcare. With United Healthcare Medicare Advantage plan, you get more with your Medicare dollar, including benefits like $0 copays for covered preventative dental services, $0 copays for lab services, and access to the United Healthcare Medicare nationwide national network. So talk to a licensed representative today about United Healthcare Medicare Advantage plans. And at Owen Insurance Group, we are all licensed and appointed with United Healthcare. So give us a call at 772-210-1020.
And WellMed, I believe, accepts United Healthcare
Hmm.
Medicare Advantage
Yes.
plan.
Think so?
Yeah, look at that.
Isn't
What
that amazing?
a great
Some-
trifecta!
Woo! Some connection. Owen Insurance Group, OIG, UHC, and
Well,
WM.
WMD.
go.
Yeah.
Yeah.
We need
Yeah,
to do that.
WMD. I like that.
Well met.
By the way, we're going to shoot to we'll talk with you about 10 common mistakes to avoid with Medicare since we're on the topic. Before we do that, though, I want to share a health facts. So Dr. Cheryl will probably say yes, especially being a DO. Proper breathing techniques,
Sitting up straight.
sitting up straight. And so you see, I'm sitting erect, breathing deeply in moments of stress or anytime during the day brings many benefits such as better circulation, decreased anxiety, and reduced blood pressure. Doc, would you say that you agree or disagree?
100%. Don't do too many deep breaths because you might pass out.
So, how
I've
many,
almost been there. No, I'm just kidding.
especially if you've been drinking a little bit
Yeah.
of tequila, maybe one or
Or
two deep
scotch.
breaths. Or scotch. I don't know who
Yes,
does
and as
that.
Dr. Jamie would say, it's what 3, 5, 7 or something, and there's like a breathe in 3, hold it for 5, and breathe out for 7, and it's really supposed to reset like your parasympathetic nervous system. And yeah, push your feet to the floor, breathe in 3, hold it for 5, breathe out for 7, and yeah, it's supposed to kind of give you this.
And I
full-
thought breathing was just.
no, that's what I'm talking
Yeah.
about.
That's Lamaze class.
Oh,
Yeah,
that
yeah.
That's
like
panic.
A dog.
Yeah.
That's kidding.
Panic.
That's
Right.
showing your
3, 5,
anxiety.
7.
Yeah.
Like, we have
Feet
to
to the
remember
ground.
that. This is great. We're
right.
learning a lot from Dr. Cheryl this morning.
What's our copay?
Right? 0.
Yay.
And then also, we're going to bring you back here in just a second, ladies. So just hang tight with us.
We'll interfere if we need to.
So we're gonna include you in. So this day in history, back in 1969, August 17th, 1969. Does anybody remember what happened? Well, does anyone know what happened?
Woodstock?
Woodstock.
Wow.
Yeah, look at you, Tommy boy.
I am a hippie.
I know you a
An
hippie.
old hippie.
So back in August 17th, 1969, one of the all-time grooviest events in music history, the Woodstock Music and Art Fair Festival, drew a close after to a close. Blah blah. Say that 3 times in a row. After 3 days of peace, love, and rock and roll.
And drugs.
And it didn't say that here, Tom.
Well,
In upstate,
I know friends that were there.
upstate, what part of
New York.
But what part of New York?
Woodstock.
Was
The
it,
town of Woodstock. No,
it didn't happen in Woodstock.
no.
Come on, Tom.
I'm stumped.
All right, so Woodstock was a product of a partnership between John, Joel, Artie, Michael, blah, blah, blah. Their idea was to make enough money from the event to build a recording studio near the Artie, New York town of Woodstock. When they couldn't find an appropriate venue in the town itself, the promoters decided to hold the festival on a 600-acre dairy farm in Bethel, New York, 50 miles away from Woodstock, owned by Max Yesker. By the time the weekend of the festival arrived, the group had sold a total of 186,000 tickets and expected no more than 200,000 people to show up. Tickets sold for $18 in advance. Sweet.
Yeah.
$24 at the gate, equivalent to $170 in today's money.
Still.
Still, yeah. I mean, come on, who wouldn't do that
Mhm.
for 3 days? By Friday night, however, thousands of eager early arrivals were pushing against the entrance gates. Fearing they could not control the crowds, they decided to open the concert to everyone free of charge. Close to 500,000 people attended Woodstock. So I'm sure there are a few people that are listening to the station and the show this morning saying, I fondly remember, or I don't remember,
Or a product of.
or I'm a
Or
product of
Right.
Woodstock.
I was born 9 months
Touche!
later.
Very good. So very cool. And of course, Jimi Hendrix ended the show with a rambling, rocking solo guitar performance of the Star Spangled Banner.
Absolutely.
Really amazing. Good times
Mhm.
for people that were there. So real quick, Tom, let's kind of talk. We've got 12 minutes left, and I want to bring back the docs before we end up closing here. But 10 quick common mistakes to avoid with Medicare. You probably don't have that one. You have the other one, correct?
I do. I have the other one.
Okay. The other one or the right one?
It all depends
Number
on the
one, not
perspective.
signing up for Medicare when you first become eligible. Is that the one you have?
I do not.
Okay. So, by the way, it's amazing that so many people don't sign up for Medicare when they first turn 65, become eligible. I got a call yesterday, another call from a client down in Palm Beach County who reached out to me the month before he was turning 65, and I kind of advised him he has to sign up for Part B and call Social Security and get that done. Well, he calls up yesterday. Do you think you did it yet?
No.
No.
Since
So-
I've been in this industry a
No.
little while, I know the answer is
And his birthday was in March, and now we're in August, so he missed his
IEP,
IEP. So he
initial
is
election period.
SCREWED. So now, because he did not, our engineer likes us, and because he did not sign up for Part B when he first became eligible, now he's going to have a 10% penalty to pay on his Part B premium when he does sign up. And now he cannot sign up now until what period?
It's called the general enrollment period.
Woo! Tom,
between
you are smoking this
and
morning.
March, and it won't become effective till July of next year.
So listen to that, people. I mean, this is serious, really. If you and this happens all the time. I don't know why it happens, but it happens. And I think it happens because people don't know who to turn to and what to do. Or they're too busy for themselves to do the essential things that's important in their lives. And number one is signing up for Part B when you first turn 65.
and many of them think, "Oh, well, my brother just got his card mailed in the mail
Right.
3 months before he turned 65. Where's mine?"
Right.
He doesn't realize that his brother is drawing Social Security,
There you go.
and that automatically triggers their Medicare to be enrolled in Part A and Part B. If you're
And-
not drawing Social Security, not so.
So, folks, please, if you don't know what to do, just pick up the phone. Call us at Owen Insurance Group, 772-210-1020. We will help you get enrolled. We'll let you know if you're not taking Social Security, like Tom mentioned, then you're not going to get your Medicare card in the mail automatically. So you have to either one of three things: go online, go to Social Security, have an appointment, or call them on the phone. Either way, if you do the latter, if you decide that you want to make an appointment to go to Social Security or to call them, have a nice novel ready to read. But if you need us to help you online, it's easy, and we'll help you get registered for your Medicare Part B. But again, make sure that you do it. You have up to 100 days prior to turning 65 to enroll in Part B. And if you wait more than 3 months afterwards,
SOL.
I'm sorry. How do you spell SOL?
S
Is
Oh. L. It's,
And what does that stand for?
Sheesh. Sheesh.
Sheesh, out of luck.
Yes.
Oh,
Sheesh.
gotcha.
Sheesh. Out of luck.
And by the way, also, if you don't sign up for Part B, you're not signing up for Part D, and you have a 1% penalty per month for every month that you don't sign up. And so, for example, it's based on the national Part B premium, so it's not ridiculous like Part B is. It's 10% penalty per year that you don't sign up, but Part D is 1% penalty of the national premium of $35 a month, 35 and change. So if you delayed your Part B premium for 2 years, instead of paying $148.50 for your Part B premium, you'd be paying about $180. Your Part D,
Wow.
if you wait to pay your Part D premium, you'd have to, for 2 years, let's say, your penalty would only be about $8.40. That would be added on top of your Part D premium. So keep that in mind. So make sure you sign up when you first become eligible. Number 2, not taking advantage of the annual AEP. Now, what is AEP, Tom?
Annual election period.
Why do people call it Medicare open enrollment period? Because we have an OEP.
We do, because it's more understandable for people. Oh, it's the annual open enrollment period.
I
This is
can't
the
see
time.
people saying it.
But it's not technically the correct phrase. And the OEP is now used at a different time of the year.
So how important is it to have an annual review during the annual election period, or known as the open enrollment for Medicare?
I would think it's just as important as having a annual physical, because you don't know if things have changed in your body since 6 months or a year that you've last seen a primary care doctor. And things may have changed moving forward. Same with Medicare plans, Medicare Part D plans, prescription drug plan, Medicare Advantage plans. Those will change each year for 2020. So your premium may be changed, the formulary may change, the doctor may be in or out of network, the benefits may change. And there's so many options now in St. Lucie County. I think there's 28 Medicare Advantage plans available. I think 34 drug plans, if I'm correct. And so those change. And each year, if your medications change, you may be better suited for your finances and save you money to get on a different drug plan.
Spot on. Number 3, not understanding the difference between original Medicare with a Medicare supplement plan and a Medicare Advantage plan. So, when we ask our clients or our prospective clients, well, what do you have? Well, what are you on? And they say, well, I'm on a supplement plan. Well, we take a look at their ID, and then what do we find?
Yeah, Medicare Advantage.
Medicare Advantage plan.
I got that supplement. I get the free gym membership, and I get my
so-
eyeglasses, and
Guys and gals, listen to
and
me.
I get the over-the-counter.
You need to know what you have, and talk to us during the open enrollment period, October 15th through December 7th, and we will be your guide. And remind me to talk about the Medicare journey before we end here.
Okay.
Number 4. If you're on a Medicare supplement or a Medigap plan, be sure you're with the right company. And most important, it's not so much about your first year premium, but more importantly is the rate stability. And make sure you review your PDP plan. Number 5, not understanding your rights and when you can switch plans, and knowing how to switch, when to switch, where to switch, and who to switch it with. Right.
Mhm.
So this is why you need number 10 to work with an independent Medicare agency that can guide you and who is unbiased, we don't represent just one carrier and one plan. We represent all the carriers and all the plans. That's why it's important to work with a professional team and an agency that's here on the Treasure Coast that works the entire state of Florida and 30 other states as well. Number 6, people will always delay, like their Part B, they'll delay buying a Medicare supplement plan or what have you. So I don't think people understand that if you wait, you may not be able to get on a supplement plan later on, because now you have to answer underwriting,
Especially if you have
conditions.
health issues.
So keep that in mind. Number 7, not understanding your out-of-pocket costs. So it's important that you work with a professional to guide you through that. Not taking advantage of LIS, low income subsidy for Part D. So we talked to a client yesterday who's on a 5-tier drug, Xeljanz, and the cost per month was over $1,300. So now, because that client is making less than $19,000 a year, she qualify for a low income subsidy. So these are important things that we know that we can help you out with. And number 9, not knowing what's not covered under original Medicare, like long-term care, dental, vision, hearing, dentures, acupuncture, and things of that nature. So again, all you got to do, it's really simple. It's complicated, it's convoluted, it's confusing.
Therefore,
But Tom and I, we bring clarity over confusion.
absolutely, we simplify that insurance planning so you could live the stress-free life that you deserve. So give us a call at 772-210-1020.
All right, we got 1 minute. We got 1 minute left, Dr. Cheryl. So 60 seconds left. What do you want to say to our listeners, those that are watching us? Any final thoughts, words, advice?
Well, I was thinking definitely start calling at 64 and a half. To me,
Yes, true.
Perfect.
I'm even more confused about when I might go on Medicare. I mean, since I am 29, it's going to be like, I'll probably be like 80 by then, right?
You got nothing to worry about.
Right. But yeah, so start calling at 64 and a half because you might be eligible at 65. You might be eligible at 67, but call first, right? But if nothing else, I mean, that I feel is so important. One of my very best friends is a insurance person, and I'm like blown away when she talks about stuff. I mean, I thought my job was complicated, but I guess it's what you enjoy, right?
Absolutely.
So if nothing else on that note, please learn how to enjoy healthy lifestyle. I encourage my patients in so many different ways. You can do chair exercises, you can walk, you can breathe, please eat right. I talk to people about, it's less money to eat well than it is to eat poorly sometimes. So health for sure.
All right. So make sure that if you're looking for a great primary care doctor, go see Dr. Cheryl up in beautiful Sebastian. And she's seeing new patients or call Tanner and they'll get you some tours of the facility. All right. Next week is Tom. It's going to be August 24th. And we're going to have another doctor on our show, Dr. Shelley Anderson of Terrapin Chiropractic. And of course, Tom, I think, and I will both be here. By the way, we want to say thanks for those of you that are tuning in and watching us. We hope you enjoyed the show. If you haven't, then you fell asleep. Please share us with your friends, your family, and your neighbors. Stay safe, keep healthy, be happy, and enjoy your quality of life.